today I'm going to share with you how I would perform a focused GI assessment on a patient. So first I'm going to begin by having the patient lying down. I'm going to first assess and observe the abdomen and make sure that it does not look distended or bloated. Make sure that there is no areas of indentation, inflation, and that the stomach appears to be flat or rounded, but looks soft, nothing that looks too abnormal, indicating any like maybe hardness or rigidness in the area of the abdomen. Next, I would move on to listening or auscultating the four quadrants. I would move from right to left, and I would make sure that I hear bowel sounds in all four areas. I'm going to indicate whether there are hyperactive or hypoactive bowel sounds, and if there are no sounds heard at all, I'm going to make sure to report this and let the doctor know. After listening to the abdomen, I'm next going to palpate gently, again moving from the right to the left, and I'm going to be aware of any rigidness or firmness to the abdomen that might indicate gas or constipation or possibly bowel obstructions. And I'm going to be asking the patient if they feel any discomfort or pain while I'm doing that. After performing the GI assessment, then I would explain to the patient that since they are on contact precaution due to being diagnosed with C. diff, I would explain that it's a communicable disease that can be transferred through contact. So while I'm in their room working with them, it is possible for me to pick up any germs, and if I'm not careful, it could be transferred to other people in the hospital, whether it's staff or other patients. So to prevent this, I'm going to make sure that I'm wearing gloves and gown every time I enter their room. I'm going to put it on before entering their room and make sure that I remove it before leaving their room. I would also let them know that if they had any visitors, that the visitors would also have to wear the gloves and the gown while they're with them, and that if the patient were to leave the room, they themselves would also have to wear gloves to make sure that, you know, if they were to touch anything, that it wouldn't transmit any of the germs to any of the surfaces. With patients that are on contact precautions or any isolation precautions, it's important to spend some time with them, maybe a little bit more than usual, just because, you know, they might have limited staff coming into their room because of the isolation, and we don't want to make them feel neglected or unimportant. So maybe spend a little bit of extra time in there, speaking with them, talking with them, offering any, you know, aids like newspapers, magazines, things like that to help occupy their time, and just make sure that they don't feel like they're being avoided because of what they're in the hospital for, and you know, make sure that they don't feel like that there's something wrong with them, that people are staying away. So yeah, I think that's all I would help, you know, to explain to the patient and help ease their worries and concerns, and just make sure that I'm always performing hand hygiene before and after entering their room and working with the patient. And again, like I said, wearing gloves and a gown each time. Thanks.